My name is Sarah, and I work in the Division of Foodborne, Waterborne, and Environmental Diseases. This means that I work on salmonella-related projects a lot. Now, I was only 2 weeks into my time as an EIS officer when I got the call to investigate an outbreak of Salmonella infantis in a county detention center. Now, this was a bit unusual because normally CDC doesn't get involved in single state outbreaks because the states decide that they can usually handle those on their own. But this time was different. This time, this particular type of salmonella was one that CDC had been following for a long time for multi-drug resistance. Now, in this talk, I'm not going to tell you about my hunt for multi-drug resistant salmonella in this detention center. Instead, I'm going to take you through my time in the jail, show you what I saw, and tell you how I feel about the state of food behind bars. It was my first time in jail, and hopefully my last, so everything was new to me. In this particular detention center, the inmates ranged from people who had been convicted of violent crimes and sexual offenses to people who couldn't make bail. In other words, people who had not yet been convicted of any crime. Inmates were separated into units, and within each unit, there were cells that housed 6 inmates and 1 toilet. Inmates would be locked in those rooms at night, but during the day, they would be allowed to mingle in a common area. There were nearly 700 inmates in the jail at the time of the outbreak, so the jail was already overcrowded and stressed. So picture a massive salmonella outbreak in this setting. 251 men, that's nearly a third of all the people in the jail, sick with salmonella. So even if you weren't the sick inmate, you were still locked 6 to a cell, trying to live, eat, and sleep only feet away from someone or more than one person having diarrhea on that one toilet. It was a mess. To say that the inmates, the corrections officers, and the medical staff were overwhelmed would be an understatement. So my job was to interview the inmates in a room by myself. And yes, there was a corrections officer standing about 20 feet away outside, but I was a little nervous. But as I sat with these men and listened to them, I started to notice things. I asked the men questions about what they had eaten in order to try to figure out what had made them sick, but I also left time for them to talk to me, and they opened up. Most of the men, if not all of them, talked about how disgusting the food was there. They told me about cat food, which is chopped up mystery meat smothered in mayonnaise. And yet they all ate it because there was no other choice. Most of these men were too poor to buy snacks from the commissary. And yet they still lost weight. After a few of the inmates mentioned weight loss, I started to notice how loosely their dirty uniforms hung on them. They also mentioned a lot of white bread and mayonnaise too. Apparently, when the kitchen runs out of a side dish, they just replace it with slices of white bread or single-serving packets of mayonnaise. This was something that I witnessed myself when I watched a dinner being prepared. Now, the US Bureau of Justice Statistics, according to them, 2.2 million adults were incarcerated in US federal and state prisons and county jails in 2013. That's nearly 1% of adults in the US resident population. In 2015, the national average amount spent on inmates was $33,274. But the amount spent on food for the inmates was less than $3 per inmate per day. Additionally, the food service is often outsourced, and companies keep whatever money that they don't spend on inmates. This creates an obvious financial incentive to spend as little as possible on feeding the people who are incarcerated, and to deprioritize adequate nutrition in favor of cutting costs. And it's not just the food service companies who had this temptation. Just last month, it came to light that an Alabama sheriff took $750,000 meant to feed inmates and instead used it to buy this beach house. Now, during the height of my outbreak, one of the corrections officers had the presence of mind to snap a picture of the dinner tray. The menu that night was chili, coleslaw, garlic bread, and a brownie. Now, when I think of those foods, I think of something like this. Here's what my inmates actually received. Yeah. Now, I have both a bachelor's and a PhD in human nutrition. I've done more dietary assessments than I can count, but you don't need multiple degrees in nutrition to know that this meal is probably subpar. This tray contains about 700 calories, which isn't actually that low for one meal, but the fact remains that inmates were losing weight, which means that the calories provided were not adequate, or that the food was so unpalatable that they just couldn't stomach eating enough of it. This is a problem in prisons and jails across the United States. The Marshall Project, which is a nonprofit news organization covering the U.S. criminal justice system, covered the state of prison food in a 2015 article. Here's a meal that was recreated from court records when a group of inmates sued a prison in Alabama. There's one slice of white bread, an unspecified amount of beans, and 2 hot dogs covered in onions. The calorie information was not available, but the average price of these meals was $1.74 a day. Compared to this, my inmates were eating gourmet. All of this penny pinching around food has consequences, and I am not the first EIS officer to notice. Mariel Marlowe, a former EIS officer in my branch, found that inmates suffer a disproportionate number of outbreak-associated illnesses. Her paper in the American Journal of Public Health recommended better food safety oversight and regulation in correctional food services, and was picked up by The Atlantic as part of a larger piece of investigative journalism. So we, the public, are starting to become aware that food safety is an important issue in prisons, and I want to challenge us to start thinking about nutrition as an important issue as well. We actually don't know much about the state of inmate nutrition because the National Health and Nutrition Examination Survey does not include people who are incarcerated. However, academic scientists have become interested in the state of food in prisons and its effects on inmates. We already know that some inmates are not getting enough calories, and a 28-day analysis of a menu at a county jail found that the meals had too many grains and not enough fruits, vegetables, and dairy. Furthermore, magnesium, potassium, and vitamins A, D, and E met less than 2/3 of the national recommendations. This assumes, by the way, that the menu was followed exactly. No white bread or mayonnaise substitutions allowed. And finally, other studies point to the lack of essential fatty acids, such as the omega-3 fatty acids that are found in fish oil. Why is this important? Micronutrients, including the ones listed on this slide, are essential for both the body and the brain. I want to introduce 2 ideas to you today. The first is that the brain is the source of all of our decision-making powers, our free will, our ability to make good choices in our lives. The second is that the brain is a physical organ with physical needs. It would follow then that if you deprive the brain of the nutrients it needs for long enough, that it will cease to function optimally. Most of us, I think, are familiar with this word. It's a combination of the words hungry and angry, and it describes a state when a person is so hungry that they become easily frustrated and irritable. Even a candy bar company that does not produce nutritious foods knows that you're not you when you're hungry. Hangry is the acute version of what I want to explore now. 2 randomized controlled trials have looked at the connection between better nutrition and inmate behavior. The first was done in the UK, and inmates were randomized to receive either an active pill with the vitamins, minerals, and essential fatty acids that were missing in their diet versus a placebo. And the scientists were looking for changes in antisocial behavior. What they found was that the inmates who had taken the active pill for at least 2 weeks had a 35% reduction in disciplinary incidents. That's just 2 weeks of supplementation. The second study was done when Dutch scientists saw these results and thought that such an incredible finding was worth trying to replicate in the Netherlands. Dutch prisoners were again given an active pill with the vitamins, minerals, and essential fatty acids missing in their diets, or a placebo, for at least 1 to 3 months. And similar to the UK study, the ones on the active pill had a decrease in aggressive behaviors and rule breaking. Now, 2 studies does not a policy recommendation make, but it's enough to start thinking critically about how the way we feed inmates has unintended negative consequences. What would happen if we provided inmates in this country with adequate nutrition? Even if you think that the 2.2 million adults incarcerated in this country don't deserve better food, or that poor food is a reasonable part of the punishment of incarceration, a decrease in disciplinary incidents and aggressive behaviors creates a safer working environment for the corrections officers and medical staff. I'm going to wrap up with a paraphrased quote from one of the lead scientists of the UK study because he sums it up beautifully. The classic criminal justice model assumes that behavior is entirely a matter of free will. But obviously, one cannot exercise that free will without involving the brain. And since the brain is a physical organ, how can it function properly without an adequate nutrient supply? Straightforwardly, it cannot. As a nation, we are incarcerating more and more people and then putting them in an environment where they are both more likely to be part of a foodborne outbreak, which is terrible, and more susceptible to developing nutrient deficiencies that put them at both a physical and mental disadvantage. I was sent to jail for an acute event, a foodborne outbreak, but it was the chronic state of undernutrition that disturbed me more. Food matters, and it's not enough that we get rid of the salmonella. Thank you.